Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. We have an extremely interesting and informative television show today, so stay tuned. Our topic for today is lifestyle, nutrition, and the use of the personal chef. I've wanted to do this television show for a long time because things are changing in our society in regards to nutrition and the way in which our lifestyle and so dramatically that many times I couldn't be more wrong. And by that, years ago, they started with doing the personal trainers. And when that first came out, I said, sounds like a good idea. I think a lot of people need instruction on personal training. But I didn't realize that a person could potentially make their living out of being a personal trainer. I said, once you train somebody, I mean, they're on their own, they're going to do their thing. I didn't realize the value of continuity, the value of structure over a long period of time was much more valuesome to the patient or the client that was doing the exercise, because it kept them on track and they made performance and they developed a good relationship and they gradually lifted up their physical sphere to a level that they didn't obtain before. So when this whole thing with the personal trainers took off, and then on TV, or I'd be reading about, like, rich people would have a personal chef on their big yacht or on their plane, or you would hear about this thing. Gradually, this has filtered down to the use of personal chefs for the average everyday person, such as yourself and myself, that has become to be not only economical but feasible and moves your physical well-being, physical and nutritional well-being forward. Of course, we're all aware of the aspect of you are what you eat, and if we were what we eat, we'd be all in pretty sad shape, the majority of us. So taking control of your nutritional well-being, for many of us, people do not have, number one, the time to cook the way in which they want to, or they have special nutritional needs and don't fully understand those dietary factors necessary to keep to bring either their weight down, keep their cholesterol in balance, keep their electrolytes so that their blood sugar or high blood pressure keeps in check. So these are all additional reasons why a personal chef would be used in somebody's life. The other negative thing that I was thinking of, or just that I didn't understand, was I thought that a person would just go out if they wanted to eat rather than cooking at home. Where would that intermediary be where you needed a personal chef? But what I'm coming to realize is that restaurants, even though the food may taste very good, quantitatively, the person doesn't know truly what kind of ingredients they're getting, whether it's cooking within the nutritional needs, the means of what their dietary guidelines are. The proportions may not be correct for what they need. A whole host of factors. So it comes back to the personal chef. So I went to the top of the food chain and found myself a celebrated personal chef who is going to be here where we're going to interview today, so that you and I can get the skinny on what this whole thing of personal chefing is all about. And I've had the opportunity to actually eat her food, and in a moment we're going to meet her, and it's definitely love at first bite when it comes to her eating. And in a moment, we're going to introduce Stephanie Martin. Please stay tuned.
By keeping my car regularly tuned, I save money on gas and repairs. That also means cleaner air. You know, feels good to help save the cash, planet.
Environmental defense, Get Green. For more tips, go to getgreen.com.
With me today is Stephanie Martin, a Brandon area resident, married, mother of two, who is a graduate of the University of South Florida with a bachelor's degree in fitness wellness. Originally, she managed fitness centers and did wellness testing and overall fitness performance until the point in which her love for cooking and overall nutrition and well-being, she wanted to integrate that and went in to be a personal chef. She runs Mealtime Magic, which is a personal chef business down in Brandon. And Stephanie, welcome on the show today.
Thank you
and
very
it's good
much.
to see
I'm
you.
glad to be here.
Can you start out by telling us a little bit about, what is a personal chef?
Basically, a personal chef is going to take the question out of what's for dinner. So many of us, myself included, you come home after a long day at work, you're tired, you're hungry, and nothing's thawed out, there's nothing in the refrigerator, so a lot of people will then resort to fast food. So a personal chef can take care of that dilemma for you. A personal chef is actually quite different from a private chef, and I have that question quite often. A private chef tends to work for one family only, like they are actually employed by a family or an individual, and they would cook for that family only. Like, say, maybe some of the movie stars may hire their own private chef to take care of their needs only. Whereas as a personal chef, I have 9 clients right now. So I can service them on a weekly, a bi-weekly, or a monthly basis.
How, if someone was considering, using that type of service or wanted to know more, how does that process start? I mean, obviously it starts by a phone call and either initiating your website or making the phone call. Take it from the phone call. I'm calling you up about your services. Where do we go from there?
Okay. I do get a lot of phone calls. I'm part of the Personal Chef Network. It's an international network of personal chefs. So I either get emails or when the phone call comes in, basically people say, how does it work? What do you do? And what I'd like to do, because everyone has specific needs and they're usually quite different, I do a free consultation. I'll go in, I'll sit down with the individual or the family. I'd like to get everyone who will be eating the food involved in the consultation, because it's at that point that I find out likes, dislikes, allergies, any health-related issues. I take care of a lot of people that have diabetes, congestive heart failure, the list goes on and on. So when I determine everything from how much garlic do you like to are you lactose intolerant, then I can put them on a schedule, find out how much food they're going to need and how often. And then from there I find out, I personally offer 3 different meal plans, which would be the 3 meals, 5 meals, or 7 meals. And by meals, I don't mean just an entree like the meat portion, say. I mean, it's an entire meal. It's well-rounded, so you'll always have protein, carbohydrate, vegetables. If someone's on a special diet right now, the South Beach diet, Atkins, Weight Watchers, if someone is trying to follow one of those dietary plans, but they're finding it difficult to do on their own, then I take over all the carb counting, point watching, whatever that plan calls for.
All the deal-a-mealing.
Yes. So I just really, I find out likes and dislikes and I put it all together. Most people, they don't really care what I fix. I know basically what they like and dislike, can and can't have. So from there, I design the menus, and then I do all the grocery shopping, bring it to their home, and I cook it, I package it, I label it, leave heating instructions with the menu, and I clean up my mess and I go. So it's a start to finish service, everything.
Now, is obviously there's what they're going to eat maybe that day or the next day. That's all just laid out more easily. Is anything frozen, or if it's in a, how does that work? I mean, at what point do you say, well, this is going to be, it's not going to stay long enough or
Right.
something like that?
Right. For those that have me make more than 3 meals, some of them are going to have to be frozen. So all of my recipes that I use are tried and true. I know which ones. There are some foods that just don't freeze well. So what I do is I have my own vacuum sealer that I carry with me. Anything that can be vacuum sealed, such as steak, chicken, what have you, anything that can fit in there and not get mushed, say like mashed potatoes, you couldn't do that very well. That is just the most important tool that I have, because by sucking out all of the air, you're going to have your food be preserved 3 to 5 times longer than it normally would. So it could stay in the freezer up to 3 months. It never lasts. It's never in there 3 months.
Right, because they're on a rotation for whatever whatever your arrangement is for what in talking to you about this program ahead of time is really pretty exciting, because you were telling me about clients that you have that one man had lost his arms and legs and had physical disabilities, that then eating this way was advantageous for him.
Yes.
And he got good quality meals. And then patients that were that were overweight. I mean, it's just the endless possibilities with proportionalizing the meals, making them fresh, wholesome, and making it so that that person isn't going to go overboard and eat too much, even if they cook healthy.
Yes.
Along with special diet stuff. Do you find that there are there a lot of people that do you do organic versus just a regular food store? Is that like a separate thing? I mean, do you?
In the area where I live and where I shop, I'm very lucky that they offer a variety of foods, and organic foods is making a big march ahead here lately. At the interview, I will ask the individual, would you like organic only food when possible, or can generic food or just name brand food, will that do? Some people are very concerned about pesticides in their food and they only want organic. However, some people realize that going to organic food will increase your grocery bill. So I give them the option. Of course, I think organic foods are better for you, but
it's a personal preference.
It's a personal preference. I don't push it one way or the other.
Yeah.
In the way that I work my business, as far as the grocery costs go, I feel like if you were going to cook your own food, you would have to buy those groceries. So I don't look at that as an added expense to the client. So whatever they're comfortable usually paying for their groceries, I just...
Right. So when that segment of the service that you provide, the food that you're buying is the food that is what you're buying is what you're buying. I mean, so that is a tabulated expense that, this is it. This is what we needed to give you that food.
Yes.
And then I guess your time is that factored into your time associated with shopping and then preparing the meals, or is it a set fee?
Well, as far as my prices go, there are a difference between the 3, the 5, and the 7 meal plan. And I can also customize plans, but that's generally what has worked out best for the clients in the past.
Now by 3 meals, that means one meal, 3 meals a week of one meal?
Well, it depends. Some people may have me come in and do 3 meals weekly. Each meal will feed 4 to 6 people. So it's not like it's one little meal for one person. It's one meal that will feed 4 to 6 people, which works out ideal for families.
Okay.
However, if I'm cooking for, say, a couple or a single person, I can split the meal in half, package it separately. That way the food will last them longer than, say, if you have a family of 4 or more eating those meals. So then they can stretch that out.
Well, it's kind of good if I have a little dietary thing, because I know from eating your food is that once you get started, you could keep on going. So it's probably good to have it as an individual,
and I do monitor portions, yes.
Portionalized things. Now, what about if a person's considering your services due to their own medical needs? I mean, is there a communication or a dialogue between you and their doctor or something like that? And the reason why I say this is that I have a lot of patients. They may be diabetic, and I teach them on a rotation diet, let's say, or an exchange diet, and I send them to the hospital, and they go for the classes that they do there. They may get it or not get it, but they don't seem to fully integrate that into what they're doing. And then, the diet aspect, which is just so important, never gets fully realized. What can you tell patients that would be considering for medical needs on how that dialogue happens?
Right. Well, I routinely ask clients that I know have medical needs if they would like me to speak to their doctor, or if I feel like I should probably talk to the doctor before I continue to service this person. I'm more than able, with my background, I have my background in the wellness field. I know everything about diabetes and heart disease and how diet affects that. And if I feel like someone has an extenuating case, I will definitely talk to their doctor. I don't have a problem doing that, because I want to make sure I have all of the facts straight on this individual. Some people I have found don't fully understand what their diagnosis is. All they know is they were told to lose weight, which means eat better, and they didn't know how to go about that, and that's why they called me, which is fine. But I also feel like maybe it's my job to help explain to them, maybe in more layman terms, of why I am cooking the way I'm cooking. Exactly what the disease can do to their body if they don't take care of themselves.
So there's the actual, just the functional aspect of it, the grassroots understanding of what they need to follow.
Well, yes, I feel like if they truly understand what their problem is and how we are going to try to help it or correct it, they're going to stick to the plan better. Knowledge is a wonderful thing, and sometimes, especially in our elderly population, they just don't quite grasp what a doctor's saying.
You're hitting on a big nerve root right there, because what happens is that as people get older, they don't necessarily have the energy or the desire to go out of their way to cook appropriately when their nutritional needs, when nutrition is essentially medicine at a time in which it's crucial for them to absorb and follow that dietary guideline. They have dwindling desires to go out and do the right thing.
Well, they don't want to cook for one person. A lot of them are widowed, and that's a big thing. They say, well, I used to cook when I had my husband or my family, but now that I'm single by myself, I don't want to cook a meal just for me. It's hard to fix, roast beef and mashed potatoes and all for one person. And I would agree with that. I mean, it would be difficult for, the everyday person to try to restructure the size of their meals. So.
It's almost like a rapid downhill slide once that occurs, because once they lose that desire, then their health in regards to the nutrition suffers dramatically. We hear so much nowadays about how much medical bills are, how much medicine is, and how much people are paying for that. It almost seems that a reproportionalizing of one's framework that they use for their nutrition and the diet and the balance, because I know when I eat your food, I feel good after eating it. I feel normalized. There's no strain on my system after eating that food. And I just know in my heart of hearts that people would benefit more, there's a whole host of people out there that they would benefit from that application of doing that. Also, when we look at the way in which we spend monies nowadays, we spend so much on taxes and this and insurance that when we look about how we pee our money away in so many other aspects, having this service of getting in the actual fuel that we need is so important. You know, I'll talk to patients and they'll put super ultra unleaded in their car, but won't understand the concept of good nutrition when it comes to their own body.
I don't think people truly understand how they can make such a difference themselves. They don't realize how just making minor changes right now could, you know, their health in the future just depends on the now. You know, if they could see that their actions now and what they do now to try to offset health problems in the future, I mean, it's we have a lot more power over our destiny as far as our health goes than what we realize. A lot of us, and I can speak from personal experience, my family background being Italian, it was just kind of the way that the grandmothers and grandfathers always thought, is that you get older, you naturally get heavier, you're naturally going to have health problems. It was, to them, it was just the inevitable.
And the aging process.
It was just inevitable. It was going to happen, so I'm going to eat what I want now and enjoy myself, and if I die, I die. And I would laugh at that as a child, thinking, that's so funny, you know, what an attitude.
I've said it many times in the past. I call it the treatment of the yet disease, which is if you don't follow the good nutritional program, you know, you're going to get those things that you haven't gotten yet.
Right.
So you need to treat the yet disease, what we don't have yet, but you're going to get if we keep on doing what we're doing. So you go and you purchase this, and then you arrange a time that the person's going to be there for the cooking. Do they have to be in their own home for that? I mean, you know, I guess in the beginning they want to be, or? Well,
in order to answer this question, first of all, let me explain that there is a difference between a personal chef and a caterer, okay? A personal chef prepares the food in the client's home, and I have insurance and liability to cover me for what I do. A caterer carries a different kind of license, a different type of liability, and they by law have to prepare food out of a state-regulated commercial kitchen. It is illegal to prepare food out of your private residence for profit.
For caterer?
Yes, so
really?
A caterer, so if you know a caterer out there who is preparing food out of their private kitchen, that's a no-no. That's a big no-no with the health board. By law, you must prepare the food out of a licensed, regulated commercial kitchen, which could be in your private home, but it has to be separate from your private kitchen, like your family kitchen.
No, that's very interesting. Just like there's the difference between the private chef and the personal chef, there's that difference between the personal chef and a caterer.
Right.
You know, I guess also it's kind of neat because the person or the consumer of your services knows for sure that the preparation of what you are doing for them is right then, it's right there, it's right specific for what they need. It's not you generically with maybe, you know, maybe you're making this for 20 other people at the thing.
There's no mass producing. I make everything specifically. When I go shopping, it's right from the grocery store to the client's home. Everything that I purchased is used, and it's fresh, and they know, you know, where it's being prepared and the conditions that surround that. You know, as far as doing dinner parties, I can, I guess for lack of a better word, cater, but I am there usually as part of the entertainment. I'll come in to do a dinner party, a wedding reception, what have you, and I will actually prepare the food there as the party's going on. And it's kind of worked out well where I'm part of the entertainment. And with Food Network, Food TV being so big now, and all the celebrity chefs that are, you know, coming out of the woodwork, it's just something that everyone enjoys watching. Everyone's fascinated to see me chop, just to put things together.
Even to pick up different techniques, which I didn't know. I mean, I've been to parties before where there were theme parties, like they would have a Japanese, like a sushi chef there.
Yes.
That the point of it would be to have Japanese food, but then also to make it educational at the same time. So I've been to, numerous circumstances where it's been either Italian chef was there and they did this up, but I never thought of that actual intermediary between not necessarily having it as, the primary focus of the party. Of course,
Right.
everybody's hanging out in the kitchen anyway.
Right.
But
usually.
it's like you're preparing the food. It's like a semi-focus of it, but yet people are mingling and doing their own stuff in the midst of a party. But the host doesn't, the host doesn't have
Right.
to
The
get
host
involved,
is free.
or it's not coming in chafing trays or something like that.
Exactly.
Everything is, bam, 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 coming
Right,
off
and I make sure when I do a dinner party, and if there are appetizers, salad, entree, dessert, I make sure that the host doesn't have to worry about, timing or anything. Right, I'm in there and I'm thinking, okay, at this time we're going to have the appetizers out, and I'll allow X amount of time for socializing, eating of the appetizers, and then I naturally just bring on things to move the party
I like
along.
the eating of the appetizers. I want you
Yes.
to know that. I like yes. I'm big on appetizers. I like a whole party of appetizers.
Everybody likes appetizers.
Yeah.
And as far as cuisines go, Italian's probably my specialty, being that I am Sicilian. However, I can cook a whole wide range of cuisines. So I have actually introduced my clients to food they would have probably never tried if it wasn't for me. So, some people, they don't like Brussels sprouts, and they're just, ooh, ick, Brussels sprouts. Well, I fix them in a way that they've never even considered or heard of, and all of a sudden, the kids are eating Brussels sprouts. So it's really been a wonderful way to introduce people to cuisine that they would have never they probably would have never cooked themselves and may only have experienced it in an upscale restaurant.
I think that the potential for introducing this service into one's lifestyle is an option after watching this show that may not have existed before. We can see the value of it. It's brought down to a way in which it's not only a value to us in regards to our health, but value some as far as actual monetary outlay to participate in this program. And I think that we've learned a lot here today about the aspects, different aspects about this. And Stephanie, I want to thank you very much for coming on the show today.
Thank you.
And welcome. Thank you very much. For Natural Healthcare Alternatives, I'm Dr. James R. Golding. Thanks for watching.